Now I want you to just put on your thinking cap and just for a minute and think about, so what can we do as individuals working in the healthcare space to address these health disparities? So how can physicians address health disparities? Physicians can do this by, first and foremost, understanding and actively screening for social determinants of health within their patient population. Here at Downstate, a couple of years ago, because CMS was mandating that any institution that receives Medicare and Medicaid funding, that we have to screen for social determinants of health. We worked with the hospital to have a brief screener, which I believe includes 9 questions, but also within our EMR system, we have the full screener, the PROPAR screener. And it's really, really important that we do this so that we understand what is going on with our patients. A lot of providers may not know that their patient has low literacy, and they keep handing them brochures and things to read, not aware that they might have a 4th grade education, for example. So understanding these social determinants of health can absolutely impact clinical decision making, which is something that I would like to work on. Number 2, advocating for policy changes. Working in the health space, we are voters. We have an ability to lobby and to write to Congress and to talk to our elected officials about those important policy changes, both on local government, state, as well as the federal. We need to provide culturally competent care, and this includes training around what is cultural humility, what is culturally competent care, and to make sure that our institution makes this mandatory across all levels of individuals working in our clinics, from the front desk to our nurses and doctors. Participating in community outreach program. I am the director of community outreach with the Bridge program, and this is absolutely huge in terms of having a face in the community to be able to say that our doctors here at Downstate care, and we're here to answer questions. And working to ensure that our healthcare workforce continues to be diverse, because as we know from the literature, having more people that are Black and brown in the healthcare force is going to improve the quality of care for our patients. And that also, when I say that, that means that also our patients are going to feel an ability to be more forthright, be able to communicate with their providers, feel that they have can have a rapport and be able to share, for example, cultural barriers that they might not necessarily feel free to talk to a doctor who is not a member of their cultural community. These are all ways in which physicians and other types of providers, nurses, OTs, PTs, can address health disparities. And now I want to just quickly remind you about some upstream interventions. Focusing on addressing the root causes of these health problems. A lot of this revolves policy changes. And we as voters and as constituents, we need to think about how we can translate our knowledge, leverage our privilege as people working within the healthcare space to try to educate people about these root causes, to raise awareness so that we can target social, environment, and policy factors that influence health outcomes. Examples include improving access to affordable housing and health care. No, this is something that doctors can't necessarily do, but if you make it a part of your practice to understand who are those resources in the community to be able to link your patients with in terms of affordable housing, that's an important step. Community resources focusing on reducing poverty or income inequality, enacting laws to promote healthy food, etc. Downstream interventions include focusing on treating and managing healthcare problems once they have developed. So, for example, here at Downstate, we have a diabetes support group and making spaces available to help educate people with chronic ailments so that they can manage their chronic ailments and hopefully reduce multimorbidity. Provide individual level interventions such as Medicaid, medical care and treatment, health education and counseling, and case management and support services. A lot of this revolves on our interprofessional teams in healthcare, and to recognize that some of these tasks and duties are impossible for providers to do themselves. And so the onus is really important to develop those relationships within the interprofessional team, to find out who's the social worker, to find out if there are any other members of the team that can help in terms of referrals to some of these outside agencies to address both the upstream and the downstream interventions that we can implement. And benefits and challenges of these interventions. Obviously, with the benefits of these upstream interventions, which I feel at this particular moment really are very political, and again, vote, talk to your elected officials, but this can have a huge impact in terms of reducing the needs for a lot of these expensive downstream care. A little bit of prevention goes a long way in terms of making sure that people are not just using the emergency room for their primary care. And some of the challenges for upstream intervention obviously are federal funding. It requires collaboration with multiple stakeholders, including government agencies, businesses, community organizations. But here at Downstate, we can do that. We have a wonderful partner in crime in terms of community organizations, which is the Arthur Ashe Institute of Urban Health, that absolutely has a longer and I believe a more positive sort of face in the community in terms of being a liaison with addressing health disparities in our community. And key strategies also include, again, screening for social needs, training around cultural competency, being engaged with our community, focusing on patient education. But of course, remember that handing people a flyer might not necessarily be the best way to health educate. I really encourage all providers to maybe create a YouTube playlist of vetted health education videos that they can also send and share with their patients for individuals who have low literacy. Advocacy and policy change, collaboration with other professionals, thinking about the interprofessional team and thinking about those on the team that have expertise in addressing complex social needs like our social workers. I think that's the most important person on in terms of geriatric team is the social worker. Research and data collection is really important for us to understand what is going on, how we're having an impact, what are the barriers. A lot of this is coming from our collecting data and trying to develop and formulate quality improvement studies to identify how we can, within our system, improve care. And then finally, promoting diversity in the healthcare workspace. So in conclusion, I want to just say that both upstream and downstream interventions are important in public health. However, addressing the root cause of health problems through upstream interventions can lead to more sustainable and equitable improvements in population health. I want to thank you for listening to my lecture and its many different sections. I am available if you should have any questions or follow-up questions or concerns, or would like any more information on some of the statistics and slides provided. I thank you for your time and attention. And don't forget, please watch that initial video as many times as you can and share it with your peers. I believe that that is a powerful, powerful teaching tool to encapsulate all the complexities of health disparities in the United States that exists beyond the COVID-19 pandemic. Thank you very much.